I have a real personal interest in mental health research. I benefited from it myself. When I had OCD, I was looking for something I could trust. I had read a lot around my condition and there was just so much rubbish online, and some of it was quite frightening and misleading. And so I knew that if I looked at Cochrane reviews, I would find something that was evidence-based, and I would know how good the evidence was because it would be measured, and I would know that it had been fairly recent and that it would have been updated. And I found some interesting evidence about what worked in OCD. And I have to say now, when I look back on that, how I think I was very lucky. I was lucky that I knew about Cochrane. I was lucky that I had access to the internet. I was lucky that I was able to read a Cochrane review because they're quite complicated. And then I was really fortunate in that I had a good GP who was interested in Cochrane, and with him I experienced for the first time what it's like to be involved in shared decision making. And he was brilliant, and he used the Cochrane evidence in a proper EBM way, put me in the driving seat, shared all the data with me. And that was a brilliant experience, but I could have missed all those things so easily if I'd been a more vulnerable person, if I'd been a seldom reached kind of person, if I hadn't had access to the internet, if I didn't have those reading skills. So whilst I've been really fortunate, I think there's an important case for trying to extend this much more widely and making it much more accessible to people. And I hope this partnership will be promoting that and make that happen.